Well, welcome those of you who are online and my fantastic committed folks who are here in person. I'm Dr. Shanna Kattari. I use they, them pronouns. I am an assistant professor here at the School of Social Work, also jointly appointed in Women and Gender Studies and the director of the Sexuality, Relationship, and Gender Research Collective, which has folks across the US and Canada. So if anybody who is here or is listening is interested in LGBTQIA2S plus research around sexuality, non-monogamy, relationships, kink, anything like that, please let me know. We have community partners as well as students and scholars for that. Of course, I'm hoping that you've already had, here, I can't make that before. So now there's the fun thing of I can't make my slides.
Did you click into it? Onto the PowerPoint?
There we go. Thank you. So I'm assuming you've already had one of these today, but I think it's also really important for me to name the land that we're on and what the history around that. Because as we live and learn on these territories, we must keep in mind the community struggles for self-determination and the colonial legacies of our scholarly practice. Here at the University of Michigan, we are on the lands that have been historically and contemporarily stewarded by the Anishinaabe, which is the Three Fire Confederacy of the Ojibwe, Ottawa, and Potawatomi nations, as well as the Wyandot Nation. And I think we as social workers, it's so important that we think about what does it mean to actually decolonize things. I think this is one of those new words that's gotten really picked up. Where it used to be intersectionality, before that was diversity. Decolonizing also includes getting land back. And so really thinking about what does it mean to decolonize as social workers and how do we support the Indigenous struggles for their pushback against settler colonization. Who am I? I think it's really important to kind of share a little bit about who we are in order to center my own privileges and where I experience marginalization in this space. So my PhD is from DU, University of Denver, with a focus on sex, gender, and disability. Before this, I'm actually not a real social worker. I only play one on TV. My master's is in human sexuality education. So I did work as a sex educator for about 10 years before I came back to get my PhD. I'm white, non-binary, middle class, English-speaking, Jewish, witchy, neurodivergent, disabled, chronically ill, queer, fat, polyamorous, femme with U.S. citizenship privilege. And so that all impacts how I move through the world in different ways. I'm a social justice advocate. I always tell my students I'm a bridge builder, right? We need people on the outside who are throwing rocks at the walls. We need people on the inside who are dismantling brick from brick. And we need people across the top who are kind of helping the two sides communicate. And that's really where I situate myself. I do a lot of work with this type of presentation for healthcare professionals. And then I do a lot of work listening to queer and trans individuals saying, what do we need to tell the healthcare professionals? I'm an institutional boundary pusher, which that's who I am, and a cat parent. And since we're doing this in person, you won't get to meet my kitties. So, we're here to learn, we're here to grow. I got my no one listens, no one learns pin on today, and that is for you all and gesticulating wildly, you all online or who are watching later, is that we're all learners in this space. And while I'm here at the front of the room getting to do shadow puppets, we're all experts in our own experience, but in general, there are no experts. And so I'm sure I will learn just as much from you all as hopefully you learn from me. And I'm welcoming questions, conversation. We all come from different backgrounds and have different experiences. So things that I talk about might bring up feelings for you. That's okay. But I encourage you to take care of yourself. So if you need to move your body, eat, stretch, etc., please do that. Okay. So I always start, because I don't know who's in the room virtually or physically, when we talk about all of these different letters. And so some people say GLBT, some people say LGBTQ, LGBTQIA2S plus, which is what I tend to use, LGBTQIA, LGBTQIA2SOP. It's a lot. And there's been a lot of ways that people talk about this differently. In NIH and CDC, which are kind of the larger health funders and health researchers in the country, they've really moved towards using SGM to stand for sexual and gender minorities, which I personally hate, to be honest, because I don't like the term minorities. I think it puts the onus on the individuals that are experiencing marginalization. And I prefer the term marginalized individuals because that onus then goes on to the society and or the people that are actively marginalizing them. SOGI is sometimes used for sexual orientation, gender identity, and expression. So SOGIE. Basically, in the way of social work, there's no one right answer, right? And so different groups you work with are going to require different things, and a lot of this is just about mirroring, right? What is the language that works for these groups? So, for example, you've heard me use the term. I was responding to somebody's question earlier, and I was like, "Oh, queer and trans people," and that's how I situate myself and how much of my community uses language. But I know if I'm going into a space with a lot of older adults, folks from rural areas, etc., I probably wouldn't start with queer and trans because a lot of those folks have a really traumatic history of like the word queer being used against them, and they may not have reclaimed it in the same way that I have. But what we're talking about underneath this alphabet soup umbrella is a couple of different things. We're talking about sex, we're talking about gender identity, gender expression, and sexual orientation with, to some extent, I really want people to also start thinking about romantic or emotional orientation. So we're going to touch on that today for a moment. Okay, so sex. This is what I put right on the thing, but I'm not going to because there's a thing down. So in the moment, baby is born, doctor or midwife or someone holds up this child, the Lion King moment. What is the first question that's asked? What is the sex? Right? Is it a boy or is it a girl? Right? Now, some people have done more legwork and sciencey stuff before that, but usually, right, that's the question, boy or girl, right? And so at birth, in the United States, we have two things that can go on a birth certificate, male or female, right? That's it. And so you'll notice the language AMAB and AFAB, that stands for assigned male at birth and assigned female at birth. And then there's also folks, about 1% of our population, who are intersex. And those are folks whose body parts don't always match up exactly with what our social expectations of their sex are, right? And so if you are not intersex, you are endosex. That is the appropriate terminology. And for intersex folks, they can be assigned at birth. For example, if their genitalia don't align with expectations or that type of thing. But a lot of intersex people don't find out until later in life. Say when they're trying to get pregnant and they find out that they have a vagina but not a uterus. Or that they have ovaries but a penis, right? And so it makes it much harder to get pregnant with that or to impregnate someone. So that's what sex is. Sex is male, female, or intersex. And there's 4 things in our society that we use to assess for sex. Any guesses? I know there's only 2 of you in here, but hopefully people online will play too. Any guesses on what those 4 things are that we use, not at birth, but throughout the lifespan to determine sex in our society?
Pronoun.
So pronouns are a thing that we use to tell people about our gender and how we want to be. So not for this, but yes, and let's make sure we cover the pronouns for sure. Genitalia. External genitalia, the junk, right? Do they have a penis? Do they have a vulva? Right? And it's actually, I always remind people, it's the same tissue. A clitoris is actually considered phallic tissue, just like a penis. And I should have done a vulva puppet, but basically at birth, or in utero, everybody starts with a vulva. And so you have internal labia, external labia, clitoral hood, and a clitoris, and then a urethra and a vaginal opening. In about 49% of cases, there's an androgen wash that goes through, and in that case, the external labia drop down and become the scrotum. The internal labia fuse around the clitoris to become the penis, and the urethra moves to the tip of the penis. Exact same tissue, which is why intersex folks are so common, because literally it's the same tissue. It just looks different in different people, okay? So yes, people's junk, excellent. What else? 4 things throughout our lifespan.
The DNA or
chromosomes. Chromosomes, yes. And I always ask folks, I'm like, how many of you know for sure what your chromosomes are? But do you know? Have you had a chromosomal check? So I know because my mom was considered a geriatric pregnancy in the 80s, and so was required to have an amniocentesis and a genetic scan. So when I was in high school biology, we're covering genetics. My mom was like, here's your chromosomes. I I took it to school because I thought I was really cool. Spoiler alert, was not cool. Still not cool, but I do know my chromosomes, right? But for the vast majority of us, just like she said, we're told what our chromosomes likely are based on the determination that doctors made on our genitalia at birth, right? Two other things. Yes.
Can it be secondary sex characteristics?
Yes, I love that. Secondary sex characteristics, right? So those are things like, do you menstruate? Do you not? Are your hips wide or are your shoulders wide? Where does your body hair grow? Is it on your face? Is it on your chest? Is it on your legs? Are you tall? Are you short? Is your voice high? Is your voice low? All of those things are considered secondary sex characteristics. But I just want us to think for a second. First of all, do we know these things at birth? No, we don't, because they don't happen until puberty, right? But do we know males who are short? Listen, I'm Jewish. A vast majority of Ashkenazi Jews are quite short, right? Do we know females who are very tall? Entire Olympic volleyball team, right? Do we know females who have facial hair? Right? There's a whole industry in helping them remove it. Do we know males that have breasts? Again, a whole plastic surgery industry trying to change that. So even these things that we were saying, these are what determine sex later in life, are not as cut and dry as this is male and this is female. Similarly, some scientists have said there's slightly over 80 things that you can use to tell the difference between males and females. And one of them I'm going to do right now. So I'd like those of you who are listening and those of you who are here to stick out your arm flat and then turn it over. So for those of you who can see, my arm does not turn all the way so that it's parallel with the floor. It's twisted. You see the twist, right? Some people's arms lay completely flat. I think back here in the black, we have a fully flat arm, right? No twist. So according to these scientists, if you have a twist, you're female, and you have a no twist, you're male. But even in this room of 4 people, we have somebody who likely differs from that. So I'm saying all of these things because we tend to talk about biological sex, or that sex is predetermined and gender is more conceptual and social. But I want to remind folks that the concept of sex is just as constructive. Just as constructive. We could just as easily divide people into 4 different sexes, 10 different sexes, based on similar sets of characteristics. And there's one more thing that we use to assess for sex. I actually already cheated and gave you some thoughts on it. It's gonads, which is the fancy word for ovaries and testes, right? But again, at birth, in male, testes haven't dropped. And so unless there's something that you're concerned about and you're getting some sort of internal scan, you're not going to know that either. So your sex at birth is determined by those things. And except for at birth, it's really only determined by your external genitalia. And I will tell you as a feminist, the idea of my entire life being determined by the size of my phallic tissue feels really problematic, right? Just in general. Okay. Where in your life do you enter your sex, male or female? What are some places?
You use the restroom, when you get your license.
Okay, so driver's license, passport. One of my partners right now is getting their passport. They're non-binary, but we don't have X's on our passport applications yet. So they had to choose, despite being someone that has breasts and a beard, which felt safer to them, male or female, right? Where else? You go, okay. Doctors, both the hospital system and health insurance. You have to enter that, right? Any other thoughts back here?
Someone online, so medical records.
Yes, your medical records. And this can get really complicated because trans people who are changing their sex markers might be someone who was assigned female at birth, but they're a man. They feel very affirmed in that. They change everything to M, but now they need to go get a hysterectomy. But the medical records say they can't get a hysterectomy because men don't have uteruses, right? And so it becomes this whole other thing. We enter them everywhere. Your car insurance is based on the cost until you're 25 is based on an MRNF. When you go to school, right? right? As alumni of this program, you had to enter M or F. And this can be an issue for trans folks because if in our society, if you are a male, you have to register for selective service in order to get financial aid. But if you are a trans man, for a very long time, you could not register for selective service because they didn't accept trans people. So then you couldn't get financial aid. You might have M's on your documentation, but not sign up for selective service. For trans women who haven't changed their markers might say male, but they can't register for selective service because they're women, right? It becomes this whole issue, right? So literally everywhere. I mean, Facebook for a long time required you to enter this even just to get a Facebook account.
Our internet participants also contributed sports.
Oh my gosh, sports, right? And this is coming up so intensely right now. I'm actually gonna go back for a second. Right? So as you may know, there's a lot of bills that are coming across many states, not just conservative states, to prevent trans youth from participating in sports. But this is also something that doesn't only affect trans people. We saw this with the Olympics, is that some females who are women, right, their natural testosterone is so high, despite not taking extra, that they were told they couldn't compete because their testosterone was higher than cisgender men. Right? It's wild how attached we are to this idea of two binary sexes and everybody needs to fit neatly in a box. Okay, so sex is over here, which may or may not be aligned with gender. And gender is who you know yourself to be. A lot of people talk about it in my heart. It's like a true sense of self. And for some people, it is that. And this is where we often hear the trans narrative of I was born in the wrong body or I've known since I was 6. And that is absolutely true experience. And for a lot of people, they didn't realize that until they're much older. And then they started hearing other terms or meeting other people that had different gender identities. And were like, oh, I didn't know I could be that. Or like, that really resonates with me. And this is all sorts of things. So woman, man, non-binary, or NB, which is spelled EMBY, but pronounced like the letters NB for non-binary. Genderqueer, trans woman, trans masculine, trans woman, trans feminine, two-spirit, which is specifically an indigenous identity that is both a sexual orientation and a gender. It is not for use by non-indigenous folks. Agender, gender fluid, the list goes on. And what I should point out too is that the man and woman that I have listed at the top of the list, they could be people of trans experience who just don't want the word trans in front of them, or they could be people who are cisgender, and we'll cover that in a second. Right? But this is who you know yourself to be. And it can change throughout time. So one of our fantastic audience members, Carolyn, has known me for like 4 or 5 years now. I was actually saying I felt a little trauma coming into this room. This is where I did my job talk to get hired here. And so she's known me since then. And when I did my job talk, I was like, I'm a cisgender woman. This is who I am. Like, I always use myself as an example when I taught. And I was like, you know, like I was assigned female. I identify as a woman. You know, well, people did a lot of processing over this pandemic. And I was like, funny story, I'm not a woman. I'm actually a non-binary femme. That's who I am. She doesn't sit right. And you know what it was for me? That was like my tipping point. Was somebody sent me a lovely pair of earrings that said empowered women empower women. And I was like, oh, that's so nice for them. But I can't wear these. These don't match me. And then I was like, oh, now I gotta do some work. Right? And so things can change throughout a lifetime. Another example where this is coming up a lot is a lot of people who transitioned 10 years ago or more are now saying, I wish I had known non-binary or genderqueer was an option, but I felt like I had to choose to go from female to male or male to female, and I didn't have that space that people are having now, right? So this also changes culturally, and these are all more US-centric language. We have Heritage in India, travesti in Brazil. There's just a lot of other language that exists. Now, I've been abbreviating trans, and trans is someone whose sex assigned at birth doesn't match the social expectations of the gender we connect with that sex. And someone who is cis or cisgender is someone whose sex assigned at birth and matches social expectations of the gender we do connect. So if you're assigned female and you're a woman, mazel tov, you're cisgender. I need to update these slides because JK, now a cisgender woman, I'm non-binary. Yeah, so you can see these are older slides. People have some big feelings about the term cisgender for some reason, and I think it's because privileged people are not as used to having language given to them or put upon them, right? Like a lot of white folks also are like, I'm not white, I'm Hungarian, Jewish, blah, blah, blah. I'm like, I am white and I'm Jewish, right? Like I experience anti-Semitism and I also experience white privilege. I think cisgender has brought up that for a lot of people. And some people also think it sounds like sissy, but it was actually a very chemistry-based term where people said in chemistry, trans means to go from one to another, to transition, and cis means to go the same direction. So that's where it comes from. We started a little late, right? I'm sorry. So gender expression, which we have sex, gender identity. Gender expression is over here, and it may or may not be correlated to your gender identity. So for example, I'm non-binary, I don't like being called lady, I don't like she and her pronouns, but obviously I'm very okay being a femme and expressing my gender in a way that's very feminine, right? Some people are very in alignment with it, right? They're like, I'm a man, I wear masculine clothing, I sit in masculine ways, which tends to be more open. I might grow facial hair, I might, for some reason, one earring is considered more masculine than two earrings, although I think that's starting to shift a bit. So gender identity and gender expression does not always equal itself. So I say this because this often happens is we see someone, and if they don't quite fit what we expect, then we're like, oh yes, what are your pronouns? But if there's someone like, I'm gonna pick on Aaliyah because I know she's okay with it. If there's someone who looks like Aaliyah, we're like, oh, she looks like a woman, so she must use she and her pronouns, right? So here's the thing: is when we talk about pronouns, you have to check with everyone, even if you assume that it's in alignment, because people see me and assume she and her, and that's not what lands with. Any questions so far, either online or person? I know this is a review for a lot of folks, but I like to give the undergirding.
We don't have, go ahead.
What?
No questions over here yet. We'll let you know if that changes.
Okay. So sexual orientation, running across may or may not be connected to your gender and your sex and your expression. And some examples include language like lesbian, straight or heterosexual, gay, bisexual, pansexual, queer, omnisexual, there's two-spirit again, indigenous only, asexual or demisexual, etc. And what I explain to people is sexual orientation is who you want to Netflix and chill with, and romantic orientation is who you want to Netflix and actually chill with. I feel like this is going to jump the shark soon. But in our society, we have this assumption that who someone is sexually attracted to is also who they are emotionally and romantically attracted to, which hasn't made sense for a long time. Even back when I was an undergrad, I knew all these people who were like, I'm sexually attracted to both men and women, but I would never want to be in a relationship with a woman, right? And at the time, it felt really homophobic, because I was like, oh, women aren't good enough for you to be in a relationship, right? Like, what is it about that? And perhaps there's some misogynistic undertones. But in general, it also could be that someone is bisexual and heteroromantic. And that's okay. There are people who are asexual and panromantic. There are people who are asexual and aromantic. And so this isn't something we talk about that much, but if you run into folks who are like, yeah, like I'm not really sexual, but I love being in relationships, right? Like that's totally normal and okay. Or someone who's like, I'm a gay man, but like I really love being in relationships with people of all genders, what's wrong with me? Nothing's wrong, right? But in our society, we really struggle with separating these out and assume that they line up for everyone. And for folks who are AFAB, right, assigned female at birth, we're much more flexible with that throughout their lifespan. So if you think about teenage girls and they have a sleepover, right? They might also share the same bed, they brush each other's hair and play around with that. They might snuggle up, to watch a movie. In our society, AMAB, assigned male at birth, so teenage boys, don't have that space, right? They don't have that space to play with. What does it feel like to be emotionally and romantically involved with someone in a way that's not sexual, right? There's like no homo, that feels really gay, that's the language we use. And so there's not a lot of space for people to kind of experiment and process with it. So when we talk about language and your patients or your clients, number one, use language that is being used by your clients. So oftentimes people will say, like, don't use homosexual, don't use transsexual. And in general, I would say don't use that as your like main word. But oftentimes people say don't ever use it, or it's outdated, no one uses it anymore. And that's actually really harmful. There's a trans woman in Detroit who speaks to a lot of my classes, and she's in her 40s. And she's like, I use the term transsexual, and every time somebody says it's only for old people or it's outdated, you're invalidating, right? And so figuring out the language that people use it back with them, right? And then some language is going to be regional, cultural, or age specific, right? So using open-ended questions instead of being like, oh, you must be queer too, saying like, how do you tell me about yourself? How do you identify your gender? How do you identify your sexual orientation? What language would you like me to use? Those are questions that are really helpful. And then you can mirror what they're using. So if I say the term queer, what does that mean to you? You being the audience. So what does it mean to you? What does it mean in your work environment? What does it mean to your clients and your patients? I'm gonna stare you down until I get some answers, either here or online. What does it mean?
The word that we heard back in the day made us think that it was somebody who was different than maybe what we all thought it was. And now what we need to do is accept that the person who's identifying themselves as being queer is letting you know information about themselves.
Yeah,
Which previously there wasn't a healthy space that was permitted.
absolutely.
Or there was a antagonistic space that was permitted.
Yeah, so Carolyn brings up a great point, right? Is that historically that word has been used pejoratively, and it also has been used to separate and isolate, right? And it's a word that's been reclaimed a lot in various spaces. To me, queer is a political identity. If I didn't want there to be a political piece, I might identify more with pansexual or omnisexual, which could be political to someone else. But to me, queer feels like when I say it, it makes you pay attention. And it also connects with the way that I view the world, the way that I move through it. Yeah.
One of our online participants says, queer is how I identify. It is a way for some people to be more inclusive than lesbian and gay.
Yep. So someone said, it can be more inclusive. I will say lots of people find queer when a partner transitions or when they're like, oh, I'm attracted to more than just this, but not also that. Like, it's a more amorphous and fluid term, right? I don't need to change my term as my attraction changes. What does that mean in your work environment? Can I ask where, I know where she works. Where do you work?
For Molina Healthcare and our Transitions of Care program.
Okay.
I've never worked with anyone who self-identifies as queer.
You've never worked with anyone who told you they self-identify as queer? Yeah, absolutely. And so where is that located?
Based in Long Beach, California, but there's a Troy office.
Okay, so right, and so sometimes it's based on people might not share something based on where they are. Sometimes it's just you don't have any clients with that identity. Sometimes it's I'm not sure if you're a safe person to tell this to. There's lots of different reasons, right? And for some people, it's not the identity that they use. They're like, yeah, I use bisexual. That's what lands right, and that's okay too. But queer also is a verb, right? To queer something. And so I'm encouraging us to queer our practices. I have a whole other presentation about this for social work, but what does it look like to queer how we show up? To queer asking questions with openness and curiosity, with putting blanks on intake forms instead of boxes, to as I queer when I teach with this idea that like it's a learning community and I'm the learner in it rather than this like sage on the stage type model. And so, thinking about how could this be used not only as an identity for your clients, but a way that you kind of change systems. On the screen right now is the gender unicorn. Some people are aware of the genderbread person. which was actually created by a white cisgender man who stole it from a trans woman and then monetized it, so we don't use that. This is the gender unicorn. It was created by trans students. And it's still, I think there's areas it can grow, but this is available online. It's translated into like 40 different languages. It also has like an interactive PDF. So this could be a great thing for you to use with someone who is still exploring things, or a young person who's like, I don't know what language to use. But the idea that I really like around it is that they're not binary based spectrums, right? So it's not masculine to feminine. It's like your gender identity. You could be 80% woman, 20% man, and 100% other genders, right? Like it doesn't limit you to only using one of those things. So here's the sex assigned at birth we talked about gender expression. Here's who you're physically attracted to. My captions are over it, but here's who you're emotionally attracted to. And it kind of brings up this like, here's your junk, right? That's your sex assigned at birth. The way you express your gender is throughout. Your gender identity is sometimes thinking about a rainbow. Physical and emotional attraction are from the heart, right? So super useful. I also find this useful with cisgender and heterosexual people who've never had to think about their gender identity or sexual orientation, because it feels very low stakes. It's fun, it's a unicorn, and it doesn't really make them question as much as plant some seeds around like, what could this look like for me? Lee, is there a question over there, or?
It's a tech issue we're looking at, sorry.
No worries. Oh, we have a poll I have to do.
Launch the poll.
Do I ask the people in, do I ask the people in here too, or they don't have to?
They don't have to do it because they are here.
Okay.
But if you want to think about the poll, you're welcome. So for our online folks, please complete the poll questions. These are part of your attendance. Another moment. All right, Shanna, our poll responses are in.
Okay. Can I close the poll? Yes. So, all right. Okay. So gender expression and gender identity are an indication of sexual orientation that is not true, that is false, right? You can be any gender and express it in any way and have any sexual orientation. They're not correlated. And the term for people whose sex assigned at birth is cis, for short for cisgender, CIS. Although I did put my little Star Wars reference in there. Oh, more polls. Sorry.
Poll is launching. Great.
All right, so on this, Two-Spirit is both a sexual orientation and a gender identity. It was actually created by Indigenous folks in 1990, 1991, across a meetup of US and Canadian, where the land is now called US and Canada, because there were so many different tribes that have different language for folks who are essentially not cisgender amongst their people. And a lot of people were mispronouncing things, didn't know about it. There was language, there's a word that starts with a B that I will not repeat, but that was used by French colonizers, who it basically refers to them as male prostitutes. And that was language that they came up for two-spirited people. So they're like, let's come up with a term in English that will allow people to talk about this experience without some of these other really harmful languages. So are all asexual people aromantic? That is false. Again, sexual orientation and romantic orientation can be in alignment, but they can also be separate. Okay, so now we got the background out of the way. This is more exciting stuff. I mean, I guess it's all exciting to me, but so what we know is that LGBTQIA2S, right, so that's lesbian, gay, bisexual, queer, intersex, asexual, and two-spirited individuals face incredibly high rates of discrimination, flat-out refusal of care, so being refused to be treated, other barriers that even includes harassment and victimization by healthcare professionals in some settings. So Michigan does not have any formal statewide policies that protect people from discrimination regarding gender identity and expression. So that's employment, housing, public accommodations, healthcare, insurance. Now, with our new AG, Dana Nessel, she has said that she's going to interpret sex as gender and sexual orientation, but this has not yet gone through any court systems. So we're kind of in an interesting experimental process. But what that means is that someone could go to a hospital and they could say, actually, we don't like to treat trans folks. We don't feel confident around it, or we don't treat your kind here. Or as Carolyn was bringing up before, if someone is a lesbian and her partner ends up in, end of life care or emergency in the hospital, if they're not legally married, they don't have to they can say, you can't see your partner, you can't do any of this, which very rarely happens with heterosexual cisgender couples, right? It usually happens to people. I will also bring up, obviously, race plays a role in this, disability status, all of these other things. The intersections of those come together. They also have less access to healthcare and face greater obstacles, even coming into the system, which means that they're more likely to avoid healthcare in general and not receive preventative care. So that's everything from PAPs, mammograms, prostate screening, dental visits, cholesterol screening, eye exams, all of that. Which means that they're already at risk for other health concerns, like general health concerns, and then are also at risk for other unique health concerns that go unaddressed. So for example, a trans masculine person who needs to have a hysterectomy or is concerned about cervical cancer may not go in to get any treatment about it because they're afraid of going to a women's doctor, right? But even here at University of Michigan, it's the women's hospital, not a hospital that, gynecological hospital. So, we're doing these polls for online folks. Sorry about the breaking. The question is, LGBTQIA2S plus folks are less likely to delay healthcare than their heterosexual or cisgender counterparts. This is a sneaky question. I realize I worded it very poorly, or maybe on purpose. Unclear. Are there just 7 that are answering?
I think only 7 are responding. So
okay. Cool. So that is false. They're actually more likely to delay healthcare. So some things that we should know is that when we're talking about LGBTQ folks, the disparities and stigma are not only about their identity, their sexual orientation. It also can come up, as I mentioned, race, gender, other pieces that come in. But when compared to their heterosexual peers, they have higher rates of HIV and other STIs, and especially women who have sex with women, so lesbian, bisexual, queer women, actually have really low rates of STI screening due to, I'm going to be generous and say lack of knowledge. I'm hoping it's not homophobia. But I mean, I myself have gone into OBGYNs, Planned Parenthoods, and been like, cool, can I get an STI screening? And they're like, but you have sex with women, you don't need one. And if you are not aware, HPV, the highest growing rate of HPV is amongst cisgender women who have sex with cisgender women. So the fact that we're not screening people for this, or assuming that because somebody says they're a lesbian, that they have not had sex with men for a variety of reasons. It could be they're sex workers, it could be sexual assault, it could be for any other reason. So high rates of HIV and STIs, low rates of screening, higher rates of substance use, higher rates of smoking, lower rates of PAPs, mammograms, and PSAs, higher rates of depression, anxiety, and higher rates of violence and victimization in healthcare systems. When it comes to trans people, I work with trans, I'm Transcend the Binary, who was my community partner in Detroit. And we in 2018 did a trans health survey of the state, which was fairly new for this. Here are just some things, the report's coming out shortly, but of the sample. So these are all trans, non-binary, gender diverse, gender queer folks, two-spirit folks. Almost 40% said their health is only fair or poor, while over half said that their mental health is only fair or poor. Almost 17% haven't had an annual exam in over 2 years. 18.6% haven't seen a dentist in 5 years. And this is, you know, some people are like, well, what about the dentist stuff? I had an amazing dentist in Denver, and we talked about all these things. And my partner hadn't gone to see the dentist in like 8 or 9 years. I was like, come on, like, she's the best. If you're gonna see a dentist, like, this is the one. And he was like, is she gonna know I'm trans when she looks in my mouth? I've seen bones, right? And so we think about how media plays into people's comfort. If you've ever watched the show Bones, she basically like looks at a skeleton and is like, this is a 42-year-old Asian man who like had malnutrition in these 4 years. And so because of that, he was like, I'm afraid that if I go to this space, like she's just gonna open my mouth and like ask me if I'm trans and want to know all these things. And I like that just, I don't have capacity for that. And honestly, I had no idea. You health research, right? And I was like, I don't know. So I like texted her and I was like, Sharon, like, can you tell us? And she was like, no, how would you tell someone's gender based on their, but none of us knew that, right? And so it's even things, not even like fear of discrimination, but like fear of being outed and fear of like then having to have that like trans 101 conversation, all of those things. Similarly, this is probably TMI, but I tell people this because I think it's really important. Is when I was in my PhD program, I had to get a transvaginal ultrasound due to pain that I was having. It turns out I had like exploding ovaries. And she asked me who I had sex with, and I was like, not cisgender men. Because I was like, I don't want a pregnancy test, and she wanted to know why. And so we're doing this, and she's like, oh, like, so I'm guessing you've never had sex before. Like, as this woman is sticking a wand into my body in a very invasive manner, I'm like having to sit there and be like, actually, people who are queer have sex. It might not look like the type of sex you expect, and I have had sex with cisgender men, right? So like, it was just such a weird environment to be in, and she thought that was an appropriate question to ask me while I was already anxious about getting this procedure, right? So these things happen. I mean, this was 5 years ago, right? Like, this is not 20 years ago somebody being inappropriate. 15% haven't had an eye exam in 5 years. Over a third haven't had a cholesterol screening in 5 years, right? And if we think about things like COVID and who it's targeting, right? Like, who's more likely, people who, overweight or obese are more likely to have more serious COVID. And these are folks who don't even know what their cholesterol levels are. 17% of those who are sexually active have never had an STI screening. And over half of them have experienced IPV interpersonal violence. Over half have current depression, with another 22 to 23% having had past depression. Again, almost 55% have current anxiety, with another 20% having had anxiety in the past. Almost half had suicidal ideation in the past year, with another quarter having had suicidal ideation previously. And this is pre-pandemic, right? So like, this is not in relationship to that. And so this sounds really negative, it's actually quite positive. So 8.4% had attempted suicide in the past year, with another 24.5% having attempted suicide in the past, which is horrific. So in case you don't know, the national average is 1.4% have attempted suicide in their lifetime. 1.4 compared to, adding things really quickly, is that 32.9%? But the national average of a trans person having attempted suicide in their lifetime is 41%. So Michigan is actually 8% lower than the national average. So something is going better here. Hopefully we can continue to bring that down. When it comes to insurance, we actually have a very insured sample. This was, when the ACA was still running, so 89% were insured. But even though people were insured, only about 11.5% had insurance that actually covered all of their trans-related needs. 61% had delayed needed healthcare in the past year. 61% delayed needed healthcare. And of those, 16.7% didn't have a trans-inclusive provider near them, so they delayed care. Almost half delayed care due to gender-based discrimination online, almost half. About 30% due to insurance not covering their needs. Again, insurance wasn't covered by their providers. Some of the trans-inclusive care providers don't even take insurance. Some of the plastic surgeons that do top surgeries and other things, so you have to pay out of pocket. And over a third could not afford their needed health care, right? So this is here in Michigan, just staggering to me. 27% don't have a primary care provider. Of those with a primary care provider, about a third didn't feel that their provider was trans-inclusive. So they might have a provider, but not someone that they feel validated with. About 70% had to educate their provider on trans-inclusive care. So imagine going to your appointment and being like, hi, I'm here, and let me tell you what prescriptions you need to give me, estrogen, I need this amount, I need all these things, which is exactly what happens. And high rates of discrimination in the past year. So this was kind of in the 2017 to 2018 year range. About a third have experienced discrimination in healthcare, 30% in an emergency room or emergency department, 28% in mental health, 24% in urgent care, 22% at a pharmacy, and 15.7% at the dentist. So the dentists are doing something really good, we just don't know what it is. So here's the poll. Are all trans and non-binary people depressed and or anxious? True or false? And the most frequent reason that trans people needed medical care, chose to delay medical care was. All right, that's our 7. I think these are almost the last polls. Being LGBTQIA2S+ is what makes people more likely to have high health disparities. True or false? And then LGBTQ people face higher rates of compared to their heterosexual peers. Options include substance use, travel-based illness, depression, anxiety, STIs, BPD, all of the above, none of the above, or some combination of the above. Ooh, we have a split. It's kind of fun sometimes because it means I can, I didn't cover something. So, all right, that is our 7.
You can talk about the answers to the 1s,
Yes.
4, or the 5s.
Yes, I will go back and do this. I just want to make sure we got through the polls. Okay, so not all trans and non-binary people are depressed or anxious, and I should be clear that a lot of the depression and anxiety is probably related to moving through a world that is filled with transphobia. And I'll bring that to the next question. The most frequent reason that trans and non-binary people delay needed healthcare is due to a fear of discrimination, particularly gender-based discrimination. Being LGBTQIA2S+ is what makes people more likely to have high health disparities. And this is false because it is the reactions to people being this way that is what triggers it, right? So we have these high rates of suicidal ideation and suicide attempts, not completed. There's another way that we're not talking about suicide that I can't remember.
The societal view,
Right. So if you're living in a space where you feel in danger, where you feel afraid, where you feel unwanted, where you are nervous about how people are going to respond to you, you're nervous about losing your job, you're nervous about getting care, all these things, it makes a lot of sense that you are more anxious. It makes a lot of sense that you're depressed. People are not naturally depressed because of their sexual orientation or gender identity. And we see this in spaces where children are allowed to just be who they are. And that they have, so there's actually research that shows if you have a trans young person in your life, all it takes is having one trusted adult, and the vast majority of people using their correct name and pronouns, and their suicide risk goes to the same level as the general youth population. just having their name and pronouns used correctly and a trusted adult who supports them. That's it. So we know that it's not inherently about being trans, and we know it's not inherently about being LGBTQ. We know it's about people's responses to being in a world where they're like, I don't know, do I check M or F? If I go into, for example, there's a lesbian couple who are friends of mine in Colorado who wanted to get pregnant, and they actually had a man who they're like, this is going to be our donor. This, like, great. But when they went into the semen collection agency, I don't know what the official terminology is, and they're like, we'd like to save money because we already have this guy, he'll give you the sperm, wash it and put it in, and they're like, no, if he's not in a relationship with one of you, he has to go through the full donor process, and you have to pay all of this extra money to make this happen. And they were like, but like literally, like he's our friend, and they're like, no, and so they wound up just, one of them had sex with him, and that's how they got pregnant, because it was literally thousands of dollars more to have had it done through a traditional IVF clinic. Like thousands of dollars, right? And so it's things like that that lead to those health disparities, and especially those mental health things.
Well, we also have that piece of there are persons who are in the spectrum of wherever they've identified themselves, but who are not out, and then are outwardly, though, that they treat people who have been identified out wrong, bad, political figures, all kinds of things that we know that happen, and it's terrible because people are not treated as human beings and are not permitted to be
Who they are.
themselves.
Yeah, well, that brings up one, the stressors of being afraid of coming out and the fear of being outed, right? Like that's a long-term chronic stress that's happening. But also, people talk sometimes about passing privilege, right? So like I look like a woman, and so I am safer if I go into a medical space and I just let the doctors call me Ms. Kattari. In my mind, I'm always like, it's doctor, but right, I'm like, okay, Ms. Kattari, got it, yes. And nurses come in and they're like, oh, her blood pressure is this, and she says this. And even though I don't have necessarily fear of them doing something wrong, it creates chronic stress in me every time that that's happening to me, right? And I'm even sometimes in spaces amongst other queer and trans folks, and her and I have been told more than once, like, thank you for coming as allies to support us. And we're like, but we are members of the community, right? So even if you are not out to people, you can see how folks are being treated, you can see some of those challenges in finding community. So yeah, that's a great point. Thanks, Carolyn. LGBTQ people face higher rates of. The answer is substance use, depression, anxiety, and STIs. So that is A, C, and D. So answer H. So what can you do, right? We talked about the what's going on, the why it matters. You can make sure that there are non-discrimination policies in your workplace that explicitly include gender identity expression and sexual orientation. I will say what's so interesting is Michigan Medicine keeps telling me they have those, but then whenever I go there and they hand me their non-discrimination policy, it doesn't include it on the paper that was given to me. So even a space that's supposed to be doing it well isn't, like, it's fine if you change them, but then you have to make it accessible to other people so they can see that. Develop strategies to maintain diverse and culturally responsive providers and staff, and that has to be ongoing. The example I can give here is I did a training for my OBGYN in Colorado. She was fantastic. For all the doctors, all the staff, great training. I was like, wonderful. And then so when trans guys would post in the Colorado Facebook groups, I'd be like, you need to go to this doctor. She's amazing. But her office staff turned over. And so one of them had seen her, made an appointment, have a hysterectomy, and came in for his like last minute pre-surgical check-in. So first of all, this place was called All About Women's Care. So you can imagine how stressful it was for a man to walk in with his masculine partner to this space. But the person at the front desk was like, I'm sorry, this is a women's office. This is for women's health care. And he tried to explain, he's like, no, but I'm getting it. And she's like, no, I don't think you know what your body parts are. And like rejected him. And so he chose not to get his needed hysterectomy because of that experience, right? So not only doing like a one-time training, but making sure people who are onboarded are also part of that process. Making sure that exams and treatments are based on actual needs and behaviors, not assumptions and labels, right? Not every gay man is at risk for HIV, but that's usually the first thing people think of. sexually active lesbian, queer, bi women should have access to STI tests. Remembering that not every trans or non-binary person wants a medical transition, but neither do they not. So, being open-minded around that. Reporting unfriendly and discriminatory practices. Oftentimes we get really nervous and we're like, oh, we like this person, or they're a good provider otherwise. But if people aren't talking about it, then they don't know they need to do better. And then when you do find great people, please refer folks to them all the time. Folks, especially up in the Troy area, that are doing a great job around this, I'd love to know. Because I have a great list here in Washtenaw County and like some folks in Southfield, but the more the merrier. Continuing to educate yourself and others, right? Language shifts over time. This presentation has shifted a lot, even in the past 5 years. So that's ongoing check-in for ongoing training your office staff around language use, best practices, gender representation, diversity, etc. It shouldn't just be providers. Thinking about the built environment, the physical environment, which is something we do a lot with gender inclusive space, with disability inclusive spaces. We also need to do for gender. So do you have gender inclusive bathrooms, and do folks know how to get to them? Are your non-discrimination policies clear and posted? Using inclusive names and signs, right? So not the women's clinic, not the women's center, that type of thing, not talking about men's health necessarily for prostates, just talking about prostate exams. Your collateral, right? So that's like your business cards, your postcards, your name tag that is inclusive, right? As well as the brochures and posters. So an IVF clinic that doesn't just have heterosexual couples on the brochures, name tags that have your pronouns on them. That's a huge thing for folks. It's an indicator that someone's going to be more inclusive. That type of thing. Having referral lists of LGBTQIA2S plus inclusive providers, and also having inclusive intake forms, which I'll have an example of it in a second. But that includes things like relationship status, making sure you also have partner or living with a partner. And I would also say adding multiple partners or dating on there. Actually, 6% of the Michigan Trans Health Survey said that they had more than one committed partner. And so are non-monogamous or polyamorous in some way. Remembering that gender isn't sex, right? Sex is male, female, intersex. Gender is all these other things. So if you actually need to know that someone is trans, right, which you might not need to know, say, for therapy, but you might need to know if you're an OBGYN, right? Then you can ask those questions, like, are you transgender or someone with trans experience? If you need sex on your thing for insurance, right, because it needs to match their card, you can ask sex and say in parentheses for insurance documentation, and then put gender blank and allow people to share who they are. Allow people to share their pronouns. So here's a really cute form that came out of George Washington University. And so it's got my name is blank, my pronouns are blank, it gives examples. I'm most comfortable using this language or languages. I believe in this faith or spirituality. I identify as a person who is and has race, ethnicity, sexual orientation, gender identity, all blanks. These are the people I want involved in my care. I would say instead of brother or sister, I should say siblings, so that's like the only negative thing on here. I'd like them to be able to, and you can choose, like come up into appointments, come into the exam room, stay in the waiting room, help make decisions, ask questions, ask for information, discuss treatments, help make financial decisions. And then it has this kind of like challenges assessment of like, over the last 3 months, I've been worried about transportation, childcare, housing, money, school, personal safety, insurance, spiritual, anything else. So this is just a really, I think you get so much more from this document that also gives you a jumping off point to say, oh, I see here that you use the word demisexual, and you're also here for an STI screening. Can you tell me a little bit more about what your sex life looks like or why you're here today, right? So I really like that form. Somebody saying something? I know I'm almost at it. Do we need to do this poll since I feel like I've asked enough questions?
That's right. Got a lot of polls, very generous with the polls.
This is from the last time I did it. You made me do a certain number of questions. So, so yes, in general, avoid assumptions. Not all of your patients are heterosexual or cisgender. I think you said before, you're like, I've never had a patient who identifies as queer. And what I remind folks is, or I have folks all the time, like, I've never met a gay person, I've never met a trans person. And I'm like, you've never met a person who told you that, right? And so even if somebody doesn't share that, like if they're doing a, moving from one thing to another, and just seeing you for case management or something, I'm not sure what your job is, I'm just kind of roughly guessing. They might also not think it's relevant, right? But it doesn't mean that, you know, you might want to have like on your general referral list, like these are the people who are especially LGBTQIA2S plus inclusive, right? Remember the difference between identity expression and behavior, right? So gay men don't all need HIV tests. Some lesbian women do, you know, like thinking about things that way. Ask all of your patients for names to be used in pronouns and actually use them, not just the patients who think would have different names and pronouns. Respect your patients' identities, even if they don't fit your perceptions. And what I always tell people is I'm like, you don't have to understand pronouns, you don't have to understand what it means to be non-binary, but you do have an ethical like piece where you have to respect it, right? And so, you know, I'm always happy to talk through with people like how do we use they, and I have like tips and tricks around that. But at the end of the day, like it doesn't matter if you don't get it, you do have to do the right thing by the folks that you're looking at. Again, thinking about, you know, what body part, like who else would need certain exams. Always use the correct pronouns. If you mess up, you acknowledge, apologize, and move on, right? So, nurse, can you bring those forms for him? Oh, I'm sorry. Could you bring those forms for them? That's all it takes. It doesn't need to be a big deal. Aaliyah and I actually had a moment earlier. Move through it. We're all fine. Treat behaviors and bodies, not identity. I don't know if we have any actual physical healthcare people in here, so I'm going to keep moving forward. But, right, like everyone with a cervix or uterus probably, you know, needs to be assessed for cervical or ovarian uterine cancer, even if they're not a woman. Everyone with a prostate, including many non-binary people, could be susceptible to prostate cancer. Every patient, every client should be screened for a relationship or domestic violence, regardless of who they're in a relationship with. And then these are just questions to reflect on, to kind of take home with you. How can inclusivity play a role in your practice? What steps are you already taking to ensure an inclusive healthcare environment? Because I know that even anybody who's here today is already doing something because you're here, I know that, right? So what are you already doing and how do you celebrate that and spread that? What community resources can you use, right? We don't have to start from scratch. And how are you including LGBTQIA2S plus folks in your ongoing education and assessment? So with that, that is me.